We are back, dear viewers, to the show Good Morning Kuwait, and we will go on with our first interview segment. Interest in the field of cosmetic medicine and plastic surgery has been known since ancient times, as the first cosmetic operation appeared by an Indian doctor at the beginning of the 6th century BC. And this field also witnessed a development in the eras of the pharaohs and the Greeks. Since then, humanity has not neglected the role of these operations in improving the appearance of the human being, his physical and psychological health as well, and having them in a better life. In order to talk more about the difference between cosmetic and reconstructive operation and the latest techniques used in these surgeries, we are pleased to have today with us Dr. Adel, consultant, plastic and reconstructive surgeon. Hello and good morning, Doctor.
Good morning, sir. How are you?
I am doing well, and I am pleased to have you here in the show, Good Morning Kuwait, to talk about this delicate, something we have here in Kuwait.
Yeah.
Could you tell us about reconstructive plastic surgery? Is a delicate surgery.
Okay,
tell us about the specialty.
Yeah. Okay, it's a good question. There's a lot of confusion that goes on when you hear plastic surgeon or plastic surgery. People automatically assume that it's cosmetic surgery. Back in the days in Canada when we were training, most of our training to become plastic surgeons was 90% reconstructive surgery. Meaning, reconstructive surgery means burn surgery, hand and upper limb surgery, craniofacial surgery, microsurgery, all these types of surgery that are put into play to preserve human life and preserve function and aesthetics, of course.
There is a misconception between reconstructive and plastic, actually.
And cosmetic,
yes. When does the pathological case require surgeries?
Okay, I mean, this is a good example also, like when you talk about reconstructive, say a lady has breast cancer and she has to lose her breast.
Yes.
This is where we come in and reconstruct that breast, give her another breast. Somebody involved in an accident, he almost loses his lower limbs. We come in and try and provide coverage to save his lower limb.
Yes.
Patients with cancer, head and neck cancer, again, say cancer of the throat or the tongue, and we have to remove all this. Then you have to reconstruct. You're removing tissues. You have to kind of reconstruct them or put it all back together.
Yes.
And this is where we come in, yeah.
So, as I said earlier, misconception, because these doctors and the surgeons, they do more than just making life beautiful, because they reconstruct. Now let's talk about the surgeries and to talk about pathological and plastic. What is the goal of the surgeon?
Preserve life.
Preserve life.
Preserve life and function, yeah.
Yeah, about the function and preserve life, and let's talk about the beauty.
Yeah.
Because we saw a lot of...
Because we do that in an aesthetic way, I mean, you can patch up things.
Do you give some, if someone comes here, this is a question everyone wants to ask, if someone comes with, let's say, more than the normal amount of plastic they need, do you suggest that they are out of their minds? Because
of course,
we saw these doctors.
I mean, this is cosmetic surgery, and cosmetic surgery is a totally different field, You have to deal with the psychology of the patient before you kind of even touch them,
Yes.
So, yeah.
As in the introduction we said, this is ancient, the plastic surgery. It's not the same, but what are the latest of techniques in terms of cosmetic and plastic surgery?
I mean, with regards to the surgery itself, really, I mean, we're very slow, and what's happening is that we're getting better equipment, better tools to work with. Like, for example, microsurgery. Microsurgery is when you kind of move tissues from one part of the body to another, and you have to kind of connect the blood vessels. I mean, better microscopes, now we can connect 1 millimeter vessels together under the microscopes, better sutures, better. And of course, a lot of that development happened in the cosmetic industry, with all the new machines that we use, all the, tightening machines, without mentioning brands, but, these machines that kind of tighten the skin
yes, this is in the term of techniques. In terms of the recovery, doctor, because a lot of surgeries, they need a lot of recovery time. Is the same or?
No. I mean, recovery depends on the procedure, If you're doing a free tissue
major.
Of course, yeah. If you're doing like lady totally lost her breast and you're mobilizing tissue from the abdomen and putting it up there and connecting blood vessels, this patient's going to recover longer. 10 days, 2 weeks, patients doing a small liposuction procedure will recover in like a day, you know. So
yes. And there's also the rhinoplasty, which is something to do with the nose,
Yeah.
and these are to do with the losing a lot of blood and adjusting with a new. I don't know if because I'm not a doctor, I don't know what's going on with the body, but
Yeah.
there's complications coming after the surgery.
Of course, yeah.
Yes.
Yeah, I mean, with every surgery comes risks, you know.
Yeah.
So as long as you explain those risks to the
Yes.
patient, be completely transparent, then but in general, we are the safest surgeries on this planet, you know. Plastic surgery is always the safest
Safe.
cosmetic, yeah.
Yes.
Of course, yeah. We operate on healthy patients,
Yes.
always.
What are the most prominent aesthetic, let's say, surgeries for men and women?
Well, for men, it's gynecomastia surgery, which is, you know, TTD, which is like when man boobs, rhinoplasties.
This is something new, by the way, doctor. We didn't see that before.
No, I mean, it
This
was
is
there
with the
before.
diet, it is with the hormone. What is
Yeah,
it?
yeah, partly, yeah. But I mean, this has been...
Is it a new phenomenon to have this?
No, with certain medications, you get this problem also. You know, with the...
Certain medication?
Yeah, like people injecting themselves in the gyms with steroids and stuff
Oh,
like
you mean
that.
the hormone imbalance?
Yeah, imbalances, and they get this, man boobs.
Because we saw that on the streets of Kuwait, we have this problem.
Yeah.
And some doctors, they said that this is a new phenomenon because maybe certain
It's
food.
not really new, no.
It's not a new
No,
thing.
yeah. So, it's been there for a while. This
And
called-
what about ladies?
Ladies, across the board, man, liposuction, tummy tucks,
Yes.
breast surgery, facelifts, everything, you know.
So, and you, because we have surgeons here in Kuwait, some people will travel, and you are famous here in Kuwait of doing a good job.
Yeah.
So what are the characteristics of a surgeon if you want to go and if you want to advise someone to go? Of course, social media will affect.
I mean, characteristics of a good surgeon is, you know, at the end of the day, it's just integrity, honesty, transparency. Yeah? You have to be very transparent with the patient. You tell them what exactly you can deliver to them without sugarcoating anything. Don't oversell, because it'll come back to bite you, you know where. Consistency in giving really good results based on medical protocols and recommendations. And that's it, yeah. I mean...
yeah, because people, they talk to each other, they recommend one doctor to other, and this is
course, yeah.
absolutely right. So what are the method of beautifying burn, which is burn cosmetic? Tell us
Burn surgery, I mean, it depends. Like if you have patients that have third-degree burns and on their skin, and they're now adults and they want to make that skin better, there's a few ways of doing it. There's serial excision, where you can cut it out slowly. There's something called tissue expansion. I don't want to get too technical, but you insert balloons under the healthy skin, expand it, and then take out the bad skin and cover it. There's like region flaps, local flaps, free tissue transfer. There's a lot of issues.
a lot of issues and
treatments.
a lot of techniques here happening in the world of plastic surgery and cosmetics. Let's talk about Kuwait. To what extent we have here in Kuwait the latest of techniques or technologies?
I mean, in Kuwait, there's all the technologies, man. I mean, we're up to date.
You don't have to go out.
No, you don't. No, for sure, no. I mean, people go out because it's maybe cheaper out. That's it.
Only for cheap.
Yeah. I mean, we have the expertise, we have the technology, we have everything. You know, so you just have to know where to go and who to go to.
So can the patient actually choose what kind of technique to use? Because you said the beautifying burns, and there's some things to do with the hormone. We talked about many things happening to the patient. Can he choose the technique of?
No, I mean, you give him options. Patient comes to your office, you diagnose the problem and tell them these are your options. If they say, no, I want you to do this with this, I said, no, it's not going to help you, sorry.
And you will reject their opinion?
Of course. How? Yeah, of course you reject.
Complications from doctors and patients, because a lot of patients, they actually tell the doctor, especially in terms of beautifying and cosmetic plastic, they said to them, no, I want more.
Everybody's a Google doctor these days. You know, they come in, they've read something online, and then they think that's what they need. But that's our job now, to educate the patients of what are their proper treatments, and if they don't accept those, what you tell them, then you know, they go away.
Even if they are extreme, do you dismiss them like this? I'm sorry, I cannot do this.
You know, as you get older as a surgeon and more veteran and more experienced, you know the patients that are extreme when they come into your office,
Yes.
and from their demands,
Especially
and
if they
you try to just get rid of them, you know, tell them to go to the next doctor.
Even if they come many times and they have a friendship with you.
Yeah, I know, yeah, but I mean, if they have friendship, it's a different thing. Then
Yes.
we're more honest, and then
Because
they
we
should
heard a
listen
lot
to
of
me.
stories, because this is the health problem now we're talking about.
Yeah,
There is a lot of health complications coming from
course.
plastic surgery,
for sure.
especially not the surgeon fault.
Yeah.
It's the, I'm not saying,
I mean, there's
is
many
it the
faults.
patient
Yeah,
or
there's many faults, but I mean that, you know, in general, plastic surgery is the safest specialty out there, and if it's done properly, everybody should have.
Thank
You know, at the
God,
end of
yeah.
the day, it's to boost the patient's confidence, and not to get him into any
Yes.
kind of complications.
Yes, and you need no introduction for that, because you're Dr. Adel. You are famous here in Kuwait for having the good job
Thank
on point.
Yeah.
Thank you so much for coming
Habibi,
to Good
thank
Morning.
you very much.
Thank you so
Thank
much.
you.
That was Dr. Adel Quttainah. And now, dear viewers, let's go to a quick break and we'll be right back.